In this video, I'm going to show you some lower body exercises that you can perform even if you have knee pain. I find that many people will stop resistance training altogether if they're dealing with knee pain and it hurts to squat or lunge because they think there just aren't any exercises that they can do pain-free. That couldn't be further from the truth, and any good physical therapist will be able to present you with exercise options to do as you get your knee pain under control. I'm going to show you 5 exercise progressions that you can use to train your lower body if you're currently dealing with knee pain. These exercises will primarily work your glute and hamstring muscles, and while they won't necessarily cure your knee pain, improving your glute and hamstring strength over time can only help it. You should still attempt to figure out what's wrong with your knee, even if it continues to bother you after avoiding the exercises that were aggravating it. What you're going to notice with these exercises is they focus on moving at the hips. Many patients cannot move well at their hips and often end up moving more through their lower back. And you've probably been told the classic line of, "Don't lift anything with your back." And many people take that to think that the hip hinge motion that I'm going to teach you today is not useful or good to do. However, learning to hip hinge properly will make you stronger, reduce your risk of low back injury, and improve your knee health. You'll notice that the exercise progressions in this video go from on the floor to standing. You should definitely master the floor exercises before progressing to your feet. Please share this video with your friends, especially if they're dealing with knee pain and not working out, because many people get weaker and weaker over time, and it all starts with something like a sore knee or a sore back that could have been avoided, and then they go from weeks to months to years of not exercising, and eventually that leads to getting weaker over time, and eventually falls in a downhill decline from there. All right, the first exercise in this progression is going to be a glute bridge. So you got to get on the floor or a stiff bed if you have a nice stiff mattress. And we're going to be on our back with our knees bent, and then we're essentially going to be lifting up our hips to start working our butt and hamstring muscles. So I'm going to show you how it looks. So I'm on the ground, knees bent, back in contact with the floor. And then from there, I'm just going to push my hips up to the ceiling a little bit, squeeze my butt, and back down. You should feel this move primarily working your butt muscles and hamstring muscles. If you feel it in your low back, you want to make sure you're moving less through your low back and more through your hips. So the whole focus of these exercises is to improve your ability to move through your hips, which is going to teach you a better movement pattern for life, take some stress off your knees, and improve your glute and hamstring strength. So phase 1, master the glute bridge on the floor or on a sturdy mattress and get better at it over time and progress from there. The next exercise you're going to move on to once you've mastered the glute bridge is called a hip thrust. All you need for this is a bench, couch, side of a recliner, just something to elevate your shoulders on, which I'll show you in a second. This is essentially a glute bridge with just a little bit more range of motion. So I have a bench here, but again, a couch or the side of a nice soft chair works just fine. I'm going to get in a position on this bench where the bench is on the top of my back, bottom of my shoulders. Just like so. You can put your arms out to the side. Notice my hips are almost at the ground to start. And then from there, I'm just going to bridge my hips up to the ceiling just like we did in the glute bridge. So a couple key pointers with this activity. Number 1, my feet are about shoulder width apart. I have about a 90-degree bend in my knees in the starting position. I'm focusing on moving through my hips and not through my back. And try and just relax your arms. You don't want to be pressing into the bench really hard, contracting everything in your upper body. The movement should come from your hips. You should feel it in your glutes. So that's the hip thrust. So we had the glute bridge, Then we progress to the hip thrust. The next progression is going to be a single leg hip thrust. So a more challenging version of what I just showed you. So I'm going to get back in that position. Hips are going to be down. All I'm going to do from here is lift up one leg. Now I'm coming up on my left leg, pausing, and back down. And one more. All the same principles that we talked about for the glute bridge and the hip thrust apply to this, except now we're just on one leg. So I was really working my left glute with that move. I think if you haven't done this before, you're going to be surprised at how difficult it is. Again, we don't want to do anything that causes any knee or back pain here. So if you're having knee or back pain, back off a little bit, master the progression prior, and make sure that feels okay, and then you can come back to this one. All right, now we're ready to progress onto our 2 feet and learn how to move our hips well in a standing position. These exercises should not bother your knees at all. I've done them with hundreds or thousands of patients over the years, and no one's complained of knee pain. So keep that in mind while you're doing them. If they're bothering your knee, you may be doing something wrong, or you really need to go get your knee checked out ASAP. So the first exercise is a basic hip hinge movement, or some people refer to it as an RDL, a Romanian deadlift. I'm going to demonstrate from the side so that you can see. What I'm going to do here, I'm standing with my feet hip or shoulder width apart, toes facing straight ahead. I'm going to have a very soft knee bend. Knees aren't locked out, and they're also not bent like a squat. So a very slight knee bend. And all you're doing from there is pushing your hips back and then bringing them forward. So it looks like this. I'm just moving my hips back and then forward. I'm going to squeeze my glutes at the top, just like we did in the glute bridge and the hip thrust variations. So push the hips back. You'll notice that my back is nice and flat. I'm not rounding over. I'm not bending from the knees. One way that you can practice this is find a wall, and you're just going to push your butt back into the wall and return. So if I use the wall over here, I'm just going to push my butt back till it touches the wall and then come through. A lot of people struggle with this move because they want to either move at their knees and squat or move at their back and do something that looks like this. Now, while I never want to tell people not to move a certain way, those probably aren't ideal if you don't know how to move at your hips first. So we want to think about hips going back and then hips coming forward. So one more time from the side. Feet shoulder width, I'm up tall, soft knee bend. From there, I'm just going to push my butt back. I should feel a stretch through my hamstrings. So you know you're doing it right if you get that hamstring stretch in. And then come back up. Just so you can see a few reps in a row, it looks like this. And that's it. You can progress to using weight over time, depending on your age and fitness level. But I find that a lot of people don't even know how to do that basic movement, and thus are never really training their hamstrings or glutes. So work on perfecting that first. Once you have it down, you can progress to holding some weight. And I'll go through that in another video. From there, we're going to move to the most challenging variation in this video, which is called a kickstand RDL, or a kickstand hip hinge. So it's that same movement, but now we're going to be more on one foot. So to look at it from the side, I'm going to be on my left foot. My right foot is behind me and just propped up nice and light. Okay, so most of my weight is on my left foot. From there, it's the same exact movement that we just did. I'm just pushing my hips back, tensioning in my hamstring, and then coming back to the starting position. So it looks like this. just so you can see it from the other side. Weight on the left foot. Right foot is just there as a little kickstand helper for balance. I do have a little weight there, but the majority is on the front foot. Push the hips back, and then come forward, squeeze your hips at the top. You're mostly going to be squeezing that left glute of the foot we're on. Do not progress to this until you have the two-leg variation mastered. And you also don't have to start with the hips going all the way back, right? You can just start right here. Again, you should feel your hamstring and butt muscles working with these moves. You should not feel your quads working, and you should not feel any pain in your knees. If you're having any back issues, I would back off. It may even help to record yourself when you're doing it or have a mirror nearby so that you can see. And you want to make sure it looks pretty similar to me. If you're doing something that looks like you're squatting down or bending your back or twisting, that's probably not the ideal way to do it. So we're going to master the two-leg hip hinge or RDL first, and then we can progress to this kickstand variation that's going to be a little bit trickier and work one leg at a time a little bit better. So give these a shot, see what you think. Again, start on the ground, take it slow, progress your way up. None of them should be bothering your knees. So if they are bothering your knees, you probably got to think about how you're doing them. Maybe you're doing too much, or maybe you need to get seen by a doctor before you know it. Thank you for watching this video. I hope that it helps you find a way to exercise even around your knee pain. If you have any questions, you can reach out to me at johnthefalldoc@gmail.com or find me on social media, Instagram, TikTok, Facebook, @thefalldoc. All right, thanks again for watching.